The New York State Nurses Association is holding a press conference after thousands of nurses walked off the job this morning. And now we listen to Mayor Mamdani.
At every one of our city's darkest periods, nurses showed up to work. Their value is not negotiable, and their worth is not up for debate. We know that during 9/11, it was nurses that tended to the wounded. We know that during the global pandemic, it was nurses that came into work even at the expense of their own health. They showed up even when we didn't have protective equipment for them. They showed up even as others were staying home. Bottom line, they showed up. They are here for us. When our parents or our grandparents fall sick or are in need, they are here for us. When our children go through an emergency, they are here for us when we face a medical issue that we do not even know the name of. These nurses are here for New Yorkers. They show up, and all they are asking for in return is dignity, respect, and the fair pay and treatment that they deserve. Yeah! They should settle for nothing less. We are here today where we do not want to be, but where we must be, on the picket line, marching for justice and fairness, standing in solidarity alongside those who have done so much for the people of this city. This strike is not just a question of how much nurses earn per hour or what health benefits they receive, although both of those issues matter deeply. It is also a question of who deserves to benefit from this system. There is no shortage of wealth in the healthcare industry. That's right. Especially so at the 3 privately operated hospital groups at which nurses are striking, the wealthiest in the entire city. The hospital executives who run these hospitals, the ones where these hardworking nurses are asking for what they deserve, these executives are not having difficulty making ends meet. The CEO and president of Montefiore made more than $16 million last year. The CEO of NewYork-Presbyterian, where we are today, made $26 million last year. But for too many of the 15,000 NYC nurses who are on strike, they are not able to make their ends meet. They are not asking for a multi-million-dollar salary. What they are asking for is for their pensions to be safeguarded, to be protected in their own workplace, to receive the pay and the health benefits that they deserve. New Yorkers have a right to quality health care, as do the nurses who provide that care. My job as mayor is to protect both of those rights, to stand alongside the working people who stand with us every day, and to build a city where everyone can live a life of dignity, not just those with the most means. So know this, New York City will do everything in our power to ensure the sick and injured can continue to receive high-quality care, and we will do so while refusing to abandon those who have time and again refused to abandon us. Right. We will not choose one or the other. Yes, right. This city can and must ensure the continuity of care. FDNY, emergency management, the public health system, and all of my senior leadership are working tirelessly to ensure nurses' demands for dignity can be heard and care is still received. All parties must return immediately to the negotiating table and not leave. They must bargain in good faith. That's right. And they must arrive at a deal that is satisfactory to all, that allows the nurses who work in this city to live in this city. I want to say thank you to every other elected official that is here to stand alongside these nurses. And I want to say to every nurse that is here, that it is time for us to recognize the work that you put in on a day-to-day basis. That's right. And we want you to know that we see the work that you do, we believe that work should be recognized, and we stand here alongside you in the fight for that. Thank you all so much for having me here. It is a pleasure and an honor always to be your mayor and to have this chance to stand alongside so many others who believe just as strongly in the importance of the work that you do. Thank you.
Thank you, Mr. Mayor. Fire it up. Yeah.
Miss James, can you talk? Can you say something to the Philippines?
I want everyone to know those greedy CEOs today put out that nurses want 40%. What nurses want is safe, quality care. What nurses want is decrease in workplace violence. What nurses want is good medical coverage, where NewYork-Presbyterian want to take away your coverage. Like you heard earlier, the CEO made $26 million last year. His 2-day salary is more than what all of us make as New Yorkers. We need to say, patient before profit, or patients are not for sale. Now, I would like to introduce a trailblazer, a fearless fight, our Attorney General, Letitia James.
All right, thank you so much. What do we want?
Fair contract.
What do we want?
Fair contract.
What do we want?
Fair contract.
I was here 3 years ago during a strike when we negotiated safe staffing. Management has reneged on that deal. Let me say that again. 3 years ago, there was a strike, and the union negotiated with management a deal on safe staffing. They have reneged on that deal. It's also important to know that this union negotiated in Albany a bill to address safe staffing.
That's right.
Safe staffing standards are the law in the state of New York. But management, unfortunately, has reneged on a deal with the union and has reneged on safe staffing standards in the state of New York. And it's important that individuals understand that, because management cannot say that they are negotiating in good faith when you renege on a deal with a union. It's important also to understand that safe staffing is critical now, as New Yorkers wake up each and every day, because after January 1st, a significant number of New Yorkers did not have health insurance because their premiums increased. And so they now will have to rely upon emergency room for health care. And safe staffing is critical to that. It's critical to ensuring that we've got quality health care here in the state of New York. It's also important to understand that safe staffing is important, particularly now that we are seeing New Yorkers suffer from the flu. We are in the midst of the flu season, and we are seeing more and more New Yorkers in our hospitals, and particularly in these hospitals. And so it's important that we have safe staffing. Healthcare workers are being stretched to their limits. And as workplace violence in hospitals is on the rise, nurses are asking simply for the basics. 1, to be respected. 2, that management not cut their benefits. 3, that they recognize the importance of safe staffing. That they also recognize that they need real protections on the job, and that fair benefits allow nurses to continue serving all of our communities. If these hospitals have money to hire scabs, then they've got money and resources to address the needs of these nurses. Hospital management is engaging in union busting. They're engaging in threatening workers, and they're preparing to spend millions on scabs. And so I urge management to negotiate in good faith, to get back to the table, to negotiate a real deal, to respect these nurses, to see these nurses, and to understand that these nurses are responsible for quality health care here in the state and in the city of New York. They need a contract. They deserve a contract. I will stand with them. I stood with them then. I stood with them in the past, and will continue to stand with them because I recognize the right to organize and the rights of these workers, obviously, to provide care for New Yorkers. This is a difficult decision for nurses. This is more than a profession. This is a passion. And it's a commitment, obviously, not only to their patients, but also they make great sacrifice to their families. And so I respect nurses, and I urge, again, a fair contract. Get back to the table, management. Respect them. I see them, and they deserve a fair contract. Thank you so much.
Thank you. Thank you, Tish. And again, we want to send the message. Nurses are not out on strike. The greedy CEOs put nurses on strike. We are not putting a patient's life in jeopardy. The greedy CEOs decided to replace us with millions that they could invest in a patient. During the height of the pandemic, those greedy CEOs with all the OOs after their names, making millions, were in their second homes playing golf while we were here taking care of the patient. We saved this city. We saved New York. We were called heroes, and today NYP called us zeros. And we are telling you, it's time to come to the table and negotiate a fair contract. And I am going to introduce a union leader. She's a registered nurse here at NYP. She's a mother. She's working. She's been here fearlessly. She has a newborn at home, where she's fighting management to provide her a lactation place so her child could be fed. And what did they do? They gave her a hard time, okay? I have 2 daughters. In the past, you could not find a place. It was a very difficult time to be a parent working full-time and have a brand new baby at home and need to take care of your baby and feed your baby. This amazing place, called themselves so amazing, could not be able to find her a place and neither to care and feed her child. A lactation place that should be all over. This is not an ask. This is regular daily living. I'm gonna introduce Beth Laden.
All right.
Good morning, everyone.
Good morning.
Thank you all so much for bringing the cameras here, the microphones here. We need to be heard.
That's right.
I apologize, I don't have a polished speech. Like we've said, we need to be at the table. We've been at the table for the past 7 days straight, and we've been at the table for the past 6 months straight. Why are we here? The nurses have been trying to get a deal that respects us and provides the safety for us and our patients. That's what it's about.
Right.
Management knows what the demands are and knows what needs to be done. And they have failed time and 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 time again to show up. It was clear, even from last week, that they had finished bargaining with us. That's why we are on an unfair labor practice strike. They have broken standards of bargaining this whole period of time. But today we made history. 16,000 NYC nurses said enough is enough. We don't have a deal. We gave them a deadline. We agreed to the deadline. We gave them 10 more days. And so we're here. We respect to be on time. We have a lot of expectations on ourselves as workers. And so we expect the same of our CEOs and our HR VPs and everybody who's across the table with all their shiny things. New York Presbyterian nurses have not been out here on the streets in 30 years. That's incredible. 30 years nurses have been able to figure out a deal. Our voices have been heard. We have negotiated in good faith. This year we negotiated in good faith, but our voice went unheard. We're here, especially with all of you, because our hospital is behind decimation to our healthcare. 44,000 nurses across New York State depend on the NYSNA Benefits Fund. And it's this hospital that is deciding for 44,000 nurses that we don't deserve care? Make it make sense. Make it make sense. It's a very clear demand, and it has real consequences. Like Nancy said, I had a baby 11 months ago. I was able to have a baby for very good price, if you could put a price on childbirth, at a NYSNA represented facility. And it was amazing, God willing, God blessed experience at Mount Sinai West. Mount Sinai West is also on the streets today. My husband also is an immigrant. He did not have health care until we got married, and he was able to come under the NYSNA Benefits Fund. This coverage has allowed him to treat all his chronic conditions and have follow-ups regularly throughout the city in a really, really amazing way. Healthcare has real consequences. We all know that. And this organization needs to hear that. 44,000 nurses deserve healthcare. We deserve to care for our community in a safe way with safe ratios and enforceable safe staffing. We deserve not to get hurt on the job. We need to have no workplace violence here. And we deserve to have health care. Thank you all. Thank you for coming.
Right.
Thanks to all the unions who are supporting us, our electeds, our community groups. We so appreciate you. But to the 4,000 New York-Presbyterian nurses, let's go!
Thank you, Beth. And I've been a nurse for close to 40 years. I work in a safety net hospital. 8 safety net hospitals. Forest Hospital in New York City were able to say, we are going to put patient before profits. They were able to come to an agreement to provide medical coverage to our nurses, to provide pension, to address the workplace violence, to also provide us with everything that's needed. And to turn around, yes, to see the richest hospital in New York City could not come to the same agreement of Forest Hospital. It's shame on them. It's shame on them. We are here today because NewYork-Presbyterian CEO, who's made $26 million last year, decided that he himself will get rid of all our medicals for 44,000 members. And we are here to send you a message. It's not gonna happen. Your 26 million, why don't you take 5 million out of your 26 million, invest it to our members, invest it to our communities. Show me what you got. Because we are here, not because we want to be here, because if everybody's on the outside, there's something wrong on the inside. I am here to introduce our colleagues, our ally, our trooper, Mario Salente, the AFL-CIO president.
Thank you, Nancy. I have one very simple message today. It really is very simple. To all of my NYSNA family here today, you are not alone in this fight. Your 2.5 million brothers and sisters and family members of the state AFL-CIO, of the entire labor movement in this state are here with you. Your brothers and your sisters and your family from public sector unions, private sector unions, building trades unions, upstate, mid-state, downstate, Buffalo to Brooklyn to Long Island, and everywhere in between. Your fight now is our fight. Your fight for dignity is our fight. Your fight for respect is the AFL-CIO's fight. Your fight for justice is the labor movement's fight. and your fight for a fair contract with fair wages and benefits and conditions of employment, fighting not only for yourselves, but for your patients, is now everybody's fight, 2.5 million strong, because this is a fight for what is right and just and true. And what is right and just and true, that these hospitals only exist because of each and every one of you. It's your dedication and your commitment, your professionalism, your skill, your talent, literally your blood, sweat, and tears that brings these patients through the times of their most vulnerable. Literally nurse them back to health. That's what is right and just and true. And what is also right and just and true, and what has been said here several times, is that you were forced to go on strike. No one goes on strike and looks forward to it. You do it as a last resort. Now we have proof, we have evidence that the nurses are being reasonable. Why? Because they've come to more than a dozen agreements already in the last week.
Right.
So they have shown, if you sit down with us, we will come to an agreement that is fair and equitable for both sides. That there is no dispute. And we talk about CEOs making what they make. It's more than that. It's the fact that they have been entrusted to lead these hospitals, to lead these organizations, and they somehow think it's a good idea to spend, I don't know, tens of millions of dollars to cause a strike that they didn't have to cause if they would just come to the table? What kind of sense does that make financially? What kind of faith can you have in leadership like that if this is the choice they made? It's insane. It's ridiculous. So, what this means is this. When I say we're all together, it's not just words. It's not just rhetoric. Anything that your president, Nancy Hagan, says that NYSNA needs, they will have all of the resources of the entire labor movement in the state at their disposal at a moment's notice, because that's what we do for each other. And I've said it before and I've said it again. The labor movement is a family. And you don't have to be blood related to be a family. And we don't have to look alike or talk alike or sound alike to be a family. A family is a group of people who care about each other, who help one another, who support one another, and who pick each other up when one of us falls down. But most importantly, it means if you pick on one of us, you have to deal with all of us now. And I know that these CEOs have not taken that into consideration. That we will be here with our brothers and sisters and family of NYSNA for as long as it takes to get a fair and equitable contract. We're all in this fight together, and together we will win this fight. Thank you.
All right.
When we fight,
We win.
when we fight,
We win.
and I'm gonna send the same message again. I got up this morning. I saw the greedy CEOs put out, nurses are asking for 40%. How much did you make last year? $26 million. We told you over and over, staffing, we're not gonna cut corners. Workplace violence, we are not gonna put ourselves in jeopardy. A pension, a medical, we are not gonna cut corners. We are willing to negotiate a wage. So stop hiding behind your gritty face. Come to the table and negotiate a fair contract. If the other hospitals could do it, if the safety net hospitals could do it, what is your excuse? What is your excuse, NYP? What is your excuse, Mount Sinai? What is your excuse, Montefiore? Now, we are here to introduce another fearless fighter that's always been with us and always standing with us. And I don't want to embarrass you, but he was proud to say Nancy. By the way, my son is going to nursing school. And I said, way to go. Our controller, Mark Levine.
All right. Nurses, make some noise. Give it up for my friend nurse Nancy Hagan. A wonderful nurse, a great labor leader, and I don't know how she's awake after the last 7 days. And let me tell you, Nurse Hagan, I'm not embarrassed that my son's in nursing school. I'm very proud of it. And in another year, he's going to be out here with the red hat, too, if we're lucky. The nurses of this city have been to hell and back over the last 6 years. You got us through COVID. You sacrificed, often at enormous personal cost. And over the years,
You have cared for us, confronting burnout in the most difficult conditions. The least you deserve now is a fair contract. I am standing with you today to fight for just that. You deserve salaries that reflect the talent and training and passion that you pour into this career. If anybody deserves great health care, it's the professionals who are providing health care to the rest of us. You should not face cuts in your health insurance plans. You deserve to be safe in your workplace. And we have seen horrific acts of violence in hospitals in New York just in the last few weeks. That is unacceptable. And most of all, you deserve safe staffing ratios. I say this because I care about nurses. And unsafe staffing ratios are causing burnout in this profession. We are losing great nurses because of the pressure of unsafe staffing ratios. But even more importantly, I want safe staffing ratios for patients. Because research shows when you have safe staffing ratios, you get better outcome for patients. That's why we're out here today. And this problem is not a hypothetical. Even in the face of agreements that you have fought for, we have seen violations. And it's not just niceness saying that. We have seen independent arbitrators declare that these hospitals are violating safe staffing ratios in NIC units, in ICUs, in cardio units. This is happening now in hospitals in New York. So I know you didn't want to strike. I know this was a last resort. You are here because there is no other option. Because we must fight for a fair contract with decent pay and good health care and safety in the workplace and safe staffing ratios. I don't know how long this strike will take, but I will be with you as long as it lasts. We'll be out here again and again and again until you get a fair contract. Thank you, nurses. Let's win this.